Yes, good to know that you're still there with us. Remember, we are discussing rubella virus on Midweek Connect edition of this week. We already have our guests in the studio that will do justice to what we are discussing this morning. We have key players, a doctor, and also a director in the agency that foresees the how immunization and every other primary health care in the state. So we'll discuss fully on immunization, training, and how to avoid contracting this virus this morning. I'm still Ifoma Ukafo. So our guests are already in the studio this morning. You're welcome. Good morning.
Thank you very much. Good morning. Thank you for having us.
Welcome. Beside me, by my right here is Dr. Eseigbe Efiomom. He is the Director, Disease Control and Immunization, Edo State. You're welcome, Doctor.
Thank you very much.
You're welcome. We really appreciate your presence. We also have my far right is Irene Wabo. She's the State Health Education Officer with Edo State Primary Healthcare Development Agency. You're welcome, Irene.
Thank you very much for having us.
Good to have you guys this morning on our program. You know, we always start our program with a background that will have a report that we did recently concerning rubella virus, about everything you have to know about it. We'll have a report we already packaged on that. So let's take a listen.
Measles rubella is a known viral infection with early symptoms of fever, cough, and malaise. Other symptoms include red eyes and rashes spreading from head down. Unvaccinated adolescents and adults are susceptible to malaria rubella, but it causes severe birth defects in pregnant women and children under the ages of 5. Meanwhile, rubella vaccine campaigns were prominent in Nigeria last year, 2025, targeting millions of children aimed for the elimination goals. With phase 2 expanding this year, 2026, capturing Edo State, it becomes imperative to ascertain the level of compliance and sensitization, especially when over 2 million children from 9 months of age to 14 years are targeted for vaccination. This, the State Health Education Officer in the Primary Healthcare Development Agency, Irene Wabo, gave an insight.
We're starting January 27th and it will span through to February 7th in Edo State. So before now, we've been having several sensitization. Relevant stakeholders have been sensitized, like the religious group. When I mean religious, we're talking about Christian and the Islamic groups. We've sensitized the education sector. We've sensitized market women, several community leaders, and all relevant stakeholders when it comes to vaccination.
From the National Primary Healthcare Development Agency, Abuja, the facilitator Binta Babakura spoke on the training of healthcare professionals.
The reason why we train these state team members is for them to be able to be knowledgeable about the measles and the rubella, and also the reason why we're even introducing measles rubella. Initially, the country has only measles vaccine. But because of the high burden of rubella, especially in the southern states, so now the federal government is also switching from measles only to measles rubella, and this is a new vaccine, is a new information. So the members of the state need to know all the basic information.
So far, 21 states have been covered for sensitization drive, as not fewer than 106 million eligible children are targeted for vaccination across Nigeria. In Benin, Ifoma Ukafo, NTA News.
Okay, thank you so much. We just watched the report we did recently on measles, rubella. So, Doc, let me start from you. What's the difference between measles, rubella, in fact, the moms, so can you just give us a backgrounder on, the different, do they have the same characteristics, the same symptoms, or just how do we know the different, the measles, rubella, the moms, and all whatnot?
Okay, thank you very much for that question. I'm sure most of our audience already have heard about measles, and many are getting to hear now about rubella. So measles and rubella are two viral illnesses that affect mostly children, and they are caused by two different viruses, the measles virus and the rubella virus. Before now, we've not been able to differentiate both of these diseases because of laboratory capacity, but we can do that now, and we can tell in the country that this is a measles case and this is a rubella case. And why it was difficult to tell was because both illnesses have similar symptoms, even though rubella presented in a milder way. So, like I said, they are both viral illnesses, and they are highly contagious, meaning that before you realize that somebody in your midst has it, you have already been exposed. So, and if there are 10 children in a room and 9 are unvaccinated, 9 of them will most likely pick it up from the 10th person that presented with the disease.
Oh, really?
Yes, that's how contagious it is. So it spreads very fast, and we have been given vaccination to prevent these.
So, before we come to vaccination, so apart from some of the symptoms that we'll just listen to on that report, what are the other symptoms that parents, pregnant women, that once they see or they experience, they'll know that they must quickly present to the hospital?
Okay, so like I said, both of them present with similar symptoms of fever. Usually starts with a fever, cough, catarrh, and many parents may not take that very seriously until they notice that the child is very ill, starts having body rash. Then they say, oh, maybe this, what could this be? And then maybe they present in a health facility and they are told. We used to have a lot of cases in years past until the uptake of immunization increased, and we saw that reducing, especially around the southern states and Edo State. So rubella also presents with similar symptoms like fever, but the rash is milder. The illness is generally milder, and within 3 to 4 days the children recover, those that have rubella, unlike measles, which is more severe in children under 5 and can lead to severe complications like pneumonia, deafness, blindness, neurological complications, and even death. Measles is one of the leading causes of death in under 5 children, and so it's very serious, and the federal government and the state government takes this very seriously. That's why immunization is pushed to the fore to ensure that we prevent our children from getting this. If you look at there's an epidemiological map that shows the incidence of measles for a given period of time in the past 2 to 3 years. It shows that the areas where you have high uptake of vaccination, you have less cases of measles. And I forgot to mention that rubella is particularly dangerous when pregnant women come in contact with carriers of the virus, and then their fetus, their children, unborn children, can actually die in the womb, or they can be born blind, deaf, or with cardiovascular hole in their heart, cardiovascular complications.
Rubella.
Yes, for rubella. So that's why rubella, we're paying particular attention to rubella. It's called congenital rubella syndrome. They can get congenital rubella syndrome, and then it can cause severe complications in the unborn child. So now that we have the ability to test and differentiate measles from rubella, we have seen that rubella is actually widespread in the country. In fact, what I've showed, maybe we'll send a map to you to show you the local governments. About 5 local governments in Edo State had cases of rubella. We had cases of rubella just last year in 2025. We had about 7 cases of rubella confirmed, laboratory confirmed cases, and about, even though our measles cases are low, we had less than 20 cases last year because of the vaccination uptake. So that's why we keep promoting the message of vaccination, so that we can prevent this disease from occurring.
Thank you so much, Doctor. So, Ms. Irene, so the doctor made mention of how severe and life-threatening this rubella, measles, rubella, and rubella on its own, standing on its own. So, how is this sensitization? Because if you check around, or you do investigative reportage before Wunan came to your office on Monday, you notice that many people don't even know about this rubella. So we find out that, okay, Edo is in the second phase of this sensitization. So is it that enough sensitization drive is not there, that people are, especially at the rural communities?
Okay, yeah, thank you very much. Like Doctor mentioned, rubella is very similar with measles. They have similar symptoms and all of that. So many persons see rubella as measles as well. Actually, the common name for rubella is German measles. So people call rubella German measles. So it's not new. However, like he mentioned earlier, we usually have a measles vaccine, but now going forward, in our primary healthcare centers and in government facilities, we'll be having the measles rubella vaccine to help curb the measles and rubella. Okay, so talking about sensitization, there's been a lot of awareness creation in the state, both at the state level and the local government level, and even the ward settlement level, like you mentioned, the grassroots. Yeah. So there's a lot of sensitization or sensitizing stakeholders. For one, in the state level, we've had several stakeholders meetings, like I mentioned earlier. We've engaged several relevant stakeholders. That includes religious, education.
Just like you spoke.
Yes, education.
Reports.
Yes, education and CSOs. Well, I mean CSOs, civil society organizations, faith-based organizations, several stakeholders. We had a whole 1 week to sensitize relevant leaders in these organizations. And apart from that, at the LGA level, the local government level and the ward level, we have several health workers that goes about sensitizing people as well in their various wards, in their various local government, to ensure that the awareness is strong about measles and the rubella. So apart from that, okay, this is one of the ways we are sensitizing too on television. We've had several television interviews, radio interviews, and our jingles presently is on air. Yes, on air, various radio stations, up to 6 radio stations to have the measles rubella jingle.
Okay, so sorry to cut in. Is it just a kind of a flash in the pan? You went to these stakeholders, just like you mentioned, the traditional rulers, religious leaders, and most times, if you're doing a research, for example, you want to get to a community, you do a need assessment, to now know what the community wants. Then at the end of the day, you might meet the religious leaders or community leaders, and these messages most times are not trickled down to the people, the actual people that really need it. So do you still do a follow-up, or you just go there, meet with the heads of communities and the heads of religious leaders?
I understand.
Just go back.
There's a lot of follow-up,
and again, the language that you use to reach to the people.
Exactly. So there's something we call advocacy, communication, and social mobilization. So that's the strategy we use when it comes to sensitizing the public. So first of all, go for advocacy. We advocate to these leaders, to let them know more about the campaign that's coming up and the diseases, of course. And after advocating, they'll definitely reach down. Then, apart from that, we also communicate in the grassroots. Okay, so we have various healthcare workers at the local government level. I mentioned that earlier. That go to the field. They go to wards and settlements. We have what we call town announcers. We have community mobilizers that go from street to street. We have house to house mobilizers that go from street to street to ensure that our people in these settlements are aware of what is coming up, are aware of the measles rubella, to be precise. So it's not just at the leaders level. So we have different stages where we carry these messages down to the people at the grassroots, in their homes, and even in their farms, in their settlement.
Okay. I will ask you the statistics, how far you have gone. But let me stay with Dr. Efiomom. You know, as a director of disease control and immunization in this primary health care agency, how do you see the issue of you said rubella is mild, and also but for pregnant women that is very severe. So how will people now know when to, because that report we watched as a lady that came from, I think she's also a director that came from Abuja, talking about the south has high percentage of this rubella virus. So what could be is it the environment or the time, or why is it that southern part of Nigeria is having this high rates of measles rubella?
Okay, thank you very much for that. The rubella cases are actually widespread, and but most of the measles cases are around the middle belt and the northern part of the country. But like I said, we had just started identifying rubella through laboratory confirmation recently, and the federal government has seen that there are widespread cases, and actions need to be taken to ensure that we don't have an epidemic of pregnant women coming down with rubella and then having to give birth to children with congenital rubella syndrome. So that is why it has led to the switch from the measles only vaccine to the measles rubella vaccine. So once our children get this vaccine, they are protected from getting measles and rubella. So it's like using two stones. Use one stone to kill two birds. Yes. So these vaccines are procured by the federal government with support from development partners, and we currently have them in the state. We have sufficient quantity, and we will be introducing them in a catch-up campaign that will cover children from 9 months to 14 years. So that's a large group of over 2 million people. So we have our health workers already on standby across the state. We have over 1,000 teams that will cover all the wards in the state in a 10-day catch-up campaign period, with some additional days to mop up areas that we haven't been able to cover in the 10 days. And we'll be ensuring that our teams go to even security compromised areas, hard to reach areas, riverine areas. We need to ensure that measles and rubella are completely eliminated from Edo State. That is our mandate, and we thank His Excellency the Governor of Edo State for his massive support for primary health care in Edo State to manage these many resources, and the manpower is not easy to even store the vaccines that we will use for these our target population, over 2 billion people. Yes, our cold store infrastructure has been completely revamped to ensure that we have the capacity to store these vaccines effectively and are able to deliver across the state.
Okay.
Yes.
Good to hear that the governor and the state healthcare is being proactive on this. But I still want to ask you on vaccination. The report we watched say is a new vaccination. So how do you plan to train? Our people they always attach myth. I know when COVID-19 was there, so many people, refused to take the vaccine. So how are you going to, get people, to now begin to accept this vaccination without attaching some myths and misconceptions around it?
Okay, so thank you very much. The measles rubella vaccine, that is not actually a new vaccine per se. It's been there, and what happens is that it was not routinized. It was not a routine vaccine in the national schedule for immunization. So those who knew the importance go to procure this in private facilities, and it's still available. I'm sure you must have heard of the MMR vaccine,
yes,
the measles, mumps, and rubella vaccine. So it's been there. We have a lot of parents that have spoken to us during the course of our engagement recently that they had this for their children some years back, procured at very exorbitant rate. But the federal government and the state government have come now to see that this is a problem that we need to stop right now, and that's why these vaccines are being procured by the federal government and is made free, completely free of charge. And like my colleague, the state health education officer, said that these vaccines are going to be available at all primary health facilities across the state and government facilities across the state, so they are free. So, and we'll be commencing their use in the state from the catch-up campaign, which commences on the 27th of January and ends in the first week of February. Yes.
Okay. Still good to is a good news to hear that. When I want to call for calling, it's a phoning program. When I come back, I want to ask Irene. A target of 2 million children from the ages of 9 months to 14 years. So how do you intend to achieve that target, that objective of grabbing this large number of units to be vaccinated? But viewers, you can call in to make your suggestion or opinion or ask questions. We are discussing measles, rubella, sensitization training and everything. Just like you heard, it is even free, targeting children from 9 months to 14 years of age. You can call this number 081 090 42594, 081 090 42594. You can even send text message on WhatsApp with that number. So Irene, back to the question of 2 million targets. So how are you going to? It's a large number. How are you going to? Yes, going to be within this short period. I think the day is very short. The period is very short. How are you going to, cover these areas?
Okay, so
18 local government areas.
Yes, sensitization is ongoing, and we didn't just start. Actually, for the whole of 2025, last year, we've been talking about the measles, rubella. Okay, so like I mentioned earlier, Edo State is in the phase 2. It's the phase 2 of the implementation in Nigeria. Last year, 2025, we had the phase 1 where we had the northern states and Oyo. They implemented the vaccination in Nigeria, and it commenced in October. So Edo just falls in the second phase. This is the second phase. We've started already. It's not new anymore. So the thing is, before then, we've already started sensitization in the state, in the 18 local government. It's just that this is, at this time, we're calling it short, is more like intensification of sensitization. So it's an intensified communication, intensified advocacy, social mobilization, and all of that. So all the 18 local governments have been sensitized. Like I said, we have several stakeholders that have been sensitized by healthcare workers in the 18 local governments of Edo State. So, and as we see, the large target, we're talking about 9 months to 14 years. When we talk about that age range, we're looking at our schools, we're looking at our education sector. That's where most of them fall into when it comes to
especially primary school.
Primary, even our crèches. When you talk 9 months, you have them in the crèche, you have them in our pre-KG, primary, secondary, and even senior secondary, because we have like 14 years in the senior secondary school 1, SS1, you have 14 years old. So it cuts across the education sector, many of them. So we're catching the education sector has been engaged. We've had several stakeholders meeting. And
Hello, sorry, it's like we have a call. Hello.
Hello, good morning.
Good morning, your name and where you're calling from?
My name is Tina. I'm calling from Mysore.
Okay, please go on.
This complaint of this Ebola virus. Can we just see the picture?
The picture? Oh,
Yes.
sorry, we...
Because I have one on my sunset, just from the neck.
Okay. Is it like rashes?
Yes.
Okay. The doctor will tell you how the symptoms.
Okay.
Doc is asking of that
Okay.
person has a rashes, so you can listen.
Okay, so I would advise her to take the child to the nearest health facility so that the child can be assessed by a trained medical personnel, and then they will tell her what to do. I also want to find out the immunization history of this child, if she completed, how old the child is, and if she completed immunization, because for children who receive all the routine vaccines, we are not afraid of what could happen. So if it's just rash, she should present to the health facility. They will be able to tell her what exactly it is.
Okay, I believe
There are
the
many
caller
causes
then.
of rash.
All right. Aaron, you were on a target catching them through schools, because I know when we were in primary school, these agencies, they used to come to our schools then to administer these vaccines. Yes. So is it still there, or just sensitize them by telling them that they should go to? Some people, Nigerians who we are, some will now be reluctant. So is it those ways, or just ordinary sensitization?
Very much the same way, not just sensitization. So sensitization is the first step after vaccination.
Hello, sorry.
Go ahead.
Okay, you heard what the doctor said.
Immunization, he's 4 years old. He finished everything.
Okay, so you can take the child to the nearest health facility to you. I think they have a primary health facility in Naifo. So you can take the child to the primary health facility in Naifo and let the medical personnel there assess the child, and they'll be able to tell you what it is.
Okay, thank you.
Okay, so like I was saying, we are ensuring that the education sector is captured, especially because of the target age, like I mentioned, from the crèches even to the senior secondary school.
Okay.
So we've had several stakeholders engagement. The Honorable Commissioner for Education also hosted one, where several stakeholders under the education sector, from the private to public schools, several several stakeholders under the education sector were invited, and we sensitized them, and they were advised to ensure that proper vaccination is takes place in their various schools.
Okay.
So that's key.
Thank you so much, Doc. Talking about training now, I keep saying this training, there is a new measles, rubella is a new vaccine, has a new vaccine. So how is the training going on? Do you have the statistics of the coverage areas, or the number of areas and people that have already covered in talking about this training?
Okay. Thank you.
Training of trainers.
Yes.
Talking about training of trainers.
Okay, thank you very much. So, first and foremost, those that will be, because this vaccine is an injectable, and it's just like the measles only vaccine. It's given just like the measles only vaccine, and you know that it's only health professionals that are trained that can administer injectable vaccines. So when I talked about over 1,000 teams across the state, these are teams made up of trained health personnel, nurses, and other medical professionals. They are the ones that are going to be going across the 192 wards of the state to ensure that every eligible child receives this vaccine. So there are several levels of training. Like you said in your report, the National Primary Healthcare Development Agency actually were in the state to train the state team and co-trainers for a couple of days. to keep them abreast with all that they need to know, and if they have questions from the public, what the appropriate correct answer should be. And today and tomorrow we'll be training the lower levels. We're training the state trainers, and then in the next maybe after the state training of trainers, we'll then train those who will be directly involved in this process, and we will actually screen them and tell them all that they should do at the lower levels while they are administering these vaccines to the children, all that they should do. So there's what we call adverse events following immunization, how to recognize it.
Okay, adverse effect, yes.
Just like any other medication.
Okay.
You could have a few people react to some drugs. Like my colleague said, we're in the second phase, so we have a lot of lessons we learned from the first phase states. This campaign went on smoothly without any untoward effect in the first phase state. So the training, this is part of the training where we tell our team members how to recognize, and there are protocols to follow. There are protocols to follow to ensure that this is a very safe process, to ensure that all we do is to protect our children and our communities. And prevention, they say,
it's better than cure.
It's better and cheaper than cure. No community or society wants a child who is born blind because of a preventable disease, or born deaf, or has cardiovascular complications. That will take a lot of money, and it will strain our healthcare system the more. Yes,
okay.
So yeah.
Okay, Aaron, let me come to you. We were on the first phase, 20 northern states plus, or you're making it 21.
Right.
Edo is in the second phase. How is your agency looking at the success stories, just like Doctor mentioned, success stories on how they achieve their objectives? Do you make a step forward to find out how you're going to, be successful in your own?
Okay, yeah, definitely. So, being Edo State, being the part of the second phase of the implementation in Nigeria, we've had several lessons learned from the first phase, and definitely we're riding on that to get better, to carry out a more robust implementation in the states, to ensure that first of all, sensitization is top-notch. Sensitization is key. Awareness creation is made, and demand for vaccines, the people request for our vaccines.
Okay, Doc. Let me still go back to statistics, because I like statistics. Have you checked how do you come up with statistics of people that are presented in the hospital, in this, talking about measles, rubella, or even rubella,
Okay, so we have administrative data for those that are present in health facilities across the state. Just like the caller said, was complaining. So if you present in a health facility, they present as probably suspected cases of these illnesses until samples are sent to the laboratory to confirm. Clinical diagnosis is made, then we can say, okay, these are confirmed cases. Like I mentioned earlier, that we had about 7 confirmed cases of rubella in Edo State in 2025. 7.
Okay.
So those are the ones that are presented to the health facilities, and samples were taken. So there could be more in the community. There could be a lot more in the community, because many people may not present to our facilities to be assessed. So that's why we've asked her to go to a health facility. When a clinical assessment is made, then samples can be collected and then sent to the lab for laboratory confirmation, because only through those laboratory testing that you can confirm that this is rubella or this is measles. And when we do that, we had about less than 20 cases, confirmed cases of measles last year. And compared to other states in the country, there are states in this country that had about 9,000 cases of measles last year. So we're doing well. It shows that
the far
north, yes, especially in those security compromised states and all those places. So we're not doing badly, and it shows that our vaccine uptake is yielding results. And you can see that we no longer see polio cases anymore.
Exactly.
These are as a result of vaccinations that have been on over the years, and that is why we're encouraging our people not to shy away from vaccination, because we don't want regrets that of children coming down with diseases that could have been prevented.
Okay, so are you also worried about self-medication? Because when you talk about measles and they say measles, rubella, people will always okay, if they have the same symptom, I can as well use all this local, you can cook sand and put agbo and so are you worried about, and how do you get people to do the right thing?
Okay, thank you very much. I know that many of our people complain about cost of healthcare and the time they may have to spend in health facilities. But what the state government has done with the Edo State Primary Healthcare Development Agency and the primary healthcare facilities under our watch, under the watch of the executive secretary of the agency, under the executive secretary of the agency, Dr. Colson Emery, we've ensured that all the primary health facilities are very fully functional, and they provide the best form of service to our people. Like I just mentioned to your caller, she mentioned that she's from Nifo, and we recognize that we have a facility very close to her, so she doesn't have to travel far. Could be within a walking distance from where she lives. When she presents there, she'll be properly assessed and properly cared for. We don't encourage self-medication because this could have untoward negative effects on the children, and they may just be managing what is not supposed to have been managed, and we wouldn't want to give any drug that the child doesn't need to that child. So the best way is, and the cheapest way, the safest way, to present to a health professional who will guide them appropriately, because they've been trained to do this.
Okay, Irene, let me come to you. Talking about security compromised area, are you also worried how to get to? Because I know some places in Edo, I know it has security challenges. So how do you also plan how to navigate those areas?
Okay, yes. To ensure that our message goes round, gets to the grassroots, like you mentioned, even to the security compromised areas, we ensure that a lot of plan is being made to ensure that sensitization is also carried to that up to that level. So in various local governments with those challenges, we actually plan with vigilantes, the government, of course. Now we know that a lot is being done on security in the state by His Excellency, the Governor of the state. But apart from that, in the local government level as well, the local health authority always lies with the vigilantes alongside the chairman, are also spearheading this to ensure that vigilantes go with these teams when they go for sensitization, and when it comes to the vaccination period, they also attach with the team to ensure vaccination is done and sensitization and all other activities are carried out seamlessly in these areas. So
okay, so what's your parting word now? Just 1 second.
Okay, so one thing I'll say is that yes, we sensitize a lot of persons, and we should, as parents, as caregivers, as leaders, you have people following you. As a leader, you should ensure that children between this age group in your community, in whatever community it is, could be education, could be in the marketplace, could be in the religious sector, ensure that children between the ages 9 months to 14 years are captured when it comes to vaccination, because vaccination is key when it comes to preventing diseases.
Thank you so much, Irene Werbo. So Dr. Esigbe Efomo.
Right.
So what's your parting word advice?
Thank you. So I would just want to advise parents and caregivers, school proprietors, to ensure that our children 9 months to 14 years receive these vaccines so that they can be protected, and the school environment and our communities can be free of measles and rubella. After this catch-up campaign, we'll be routinizing the vaccine. That means it will become part of the routine vaccines, and then it will be only available for 9 months and 15 months old babies in our health facilities.
Thank you so much, Dr. Esiegbe Efeomom is the Director of Disease Control and Immunization, and also Irene Wabo, the State Health Education Officer in that agency. We thank you for coming this morning and your insights on this, what we discussed this morning: malaria, measles, rubella, and rubella, on its own. You have heard it from the horse's mouth that you don't need to shy away from going to get these vaccines. That the sharing news is that it's even very cheap. That is cheap. You don't free. You don't even free underline free. You don't even have to pay anything. So what is stopping you from going to your nearest healthcare facility to get your child vaccinated against this measles, rubella, so that health is wealth. When your child is healthy, you are happy, you're also wealthier. Targeting children from 9 months to 14 years of age. So what's stopping you from doing that? We thank you for being part of our discussion this morning. We keep a date with us next week when we come your way with another interesting topic. Till then, bye.